Tommy Douglas funded and talked about the first stage of Medicare, which is universal health care. The second stage is health promotion. So people are wanting to take better care of themselves now. People are interested in health promotion, and CHCs have been funded as the only model with health promotion in the Ministry of Health. So that's what we've been doing for the past 30 years. So to talk about our community here in Lambton Shores, North Lambton Community Health Center has been around for 17 years. We started with our original 2 sites here in Forest, uptown here, 59 King, and Kettle Point site. We expanded in 2007 and 8 with new sites in Sarnia and Watford. We were asked by the Ministry of Health to participate in capital projects and to run those facilities. So those are our 4 sites. We're unique in that we have urban, rural, and First Nation sites. Most health centers will have one population to serve. So here's the boundaries, and these are Ministry and Lynn approved. So North Lambton, the original green, is the Kettle Point Forest site. We have our new West Lambton boundaries, and our new Watford boundary is the purple. The gray here is Petrolia Blue Water Health CEE catchment area. We have our sister site to the north, Grand Bend. So we have 2 community health centers in Sarnia-Lambton. And there's approximately 100 communities who have put in proposals for a health center. So we feel that we're well served with the 2 centers, and we work together in many partnerships. And again, funded by the ministry and approved, we all have certain groups that we're funded to take care of. So in the North Lambton, we serve a lot of seniors, First Nation, youth at risk, low income. More moderately mentally ill in the urban sites, there tend to be more people there, and rural families. So each health center will have its own priority group, which the ministry approves. So those are ours. We provide clinical services, which is one focus of the health center. So we're up to about 100 staff and 100 volunteers with a community-governed board of directors. So we have had a growth from 8 people to 100 in the past 17 years. The second focus of health centers is health promotion and a focus on health and well-being. So here's our expertise, and it's delivering of free health promotion programs to the community. We don't just do it at the health center here or in Grand Bend. We have many outreach locations. We go to where the need might be. And we do community initiatives like our after-school program that you are well aware of with the Lambton Shores and our partnership for Space. And it's an upstream approach to health prevention before people get sick. So this is catching on. People are wanting to do this, and we're lucky we've got a great team of volunteers and support in the community for these services. So here's our locations currently. You can see the 4 blue swirls. That's our provincial logo. That means if you see that symbol, that's a community health center. So Grand Bend has one on their walls, as we do. And these green dots indicate where we're offering programs currently. So we're spread out quite a bit over the community. And these are numbers for 2011. So lots of events, lots of people. We go to the Capel Street apartment building. We're at Kettle Point with the One Tomato Project. We're in Warwick. And at Warwick, we have a gentleman our lady there that walks, and she's in her 90s twice a week. So it's never too old to start. Everyone's getting in on health promotion. And we don't do it alone. We've grown a bit from the 74 volunteers, but we have a team of volunteers who go out into the communities, who are trained facilitated to offer these services. We have our volunteer coordinator, and we've got lots of pictures, but just to show you how we deliver these programs is with the support and the people in the community. Social factors addressed. We address a lot of these factors. I'm not going to go through them all, but people are taking charge of their own health and wanting to learn these strategies in coping. So the health promotion side works very hard to help people with these issues. So community engagement, like I said, we certainly don't do this alone, not even with our volunteers. We work with many partners in the community. So at North Lambton, we have 2 community engagement groups, one in North Lambton, one in Sarnia. We have about 15 partners sit around the table. We look at gaps in programming, trends, we look at avoiding duplication. We work together so that we're not all doing the same thing and using our resources the best we can. partners, one of the partners is in the audience tonight, the YMCA, so we are pleased that, you know, it takes a while to learn who's doing what and what goes forward, but we are going to be working closer with the YMCA, especially hopefully in the area of after-school program to avoid duplication, to work in chronic disease management, to perhaps write grants and proposals to get more resources for those gaps that we see in our community, especially with the teens and some of the working young people. So that's a list there. And the after-school program is a community initiative. So this program started out in 2003-04, and it was one site. It's grown to 4 sites, and Lambton Shores supports us in Bedford and Forest, and also Kettle Point Band Office provides us with space, and now Watford gives us space as well. So with the in-kind space, we're able to bring investment into the community for programming that serves, this is the first year for Watford, and it's booming there with 74 registered participants. There's about 300 kids that come overall. We have the Kettle Point bus, we go swimming, we go skating, we go to events, and we have all the kids come together on PA days between all the communities because they often don't see each other until high school. So it's a very program that's a great need for those children that can't afford others. And we are been asked to write another proposal for Ongenom this year, which will probably support them and try to get an after-school program there. So I focused on the Forest site tonight. So just so you know that there's clinical services, there's health promotion services, but there's also other services to the community that are free and for everyone. We have 2 tenants, Blue Water, X-ray and ultrasound. Those, anyone with a note from your physician can come and utilize those. Public health is in our building. We have an allergist that comes twice a month, that's open to anyone in the community. We have social workers that are free, there's no charge for them, dietitians. We do drug rehabilitation referrals. We have blood work for community clients. We do well women exams. We work with our other area physicians as well in the areas of education and pandemic planning. And 3 at the bottom, I'm just going to skip to the next page because I've gone into a little more detail here. So chronic disease, we know, is going to be big in the future. That's all we hear about. Child obesity. We're seeing kids that, you know, in their 30s now have chronic disease where it used to be in your 60s and 70s. So our LHIN has funded COPD teams and falls prevention teams. Not all the LHINs, very few LHINs have done that. So we're very fortunate to get the resources for these dedicated teams that are open to the community that are going to deal with chronic obstructive pulmonary disease and falls prevention and free grab bars. We also have had 2 diabetes teams, one in North, one in West, which is also free counseling and group activities for people. So it is starting to really take off because we have Dr. Parker, who's a respirologist, endorsing our program, and we have a pulmonary rehab component to it as well. We work in partnership with Grand Bend again. They have a team. We meet monthly with their team. Grand Bend covers the Petrolia area because they don't have any coverage there, and Grand Bend comes down into Bedford just for COPD. But we are working together with our sister CHC there. And this is a list of agencies that were previously with the North Lambton Social Services. So we have offered the agencies that were with North Lambton Social Services to remain at the center. All were offered space, and these group here have agreed to stay. So we have agreements with them, and they are all on board as of April the 1st. So again, social service type services for the community. Those are free and no charge. And then the next one are 2 new programs that are coming later this month. So the Red Cross is offering both of them. One is Homeward Bound. So if you're in the emergency room and you come home, there's free services for any senior. And then the Red Cross transportation is a Red Cross van that will take people to medical appointments, shopping, into Ontario Works, and that's open to all community members as well, but they need to be of the lower income, and we will be doing referrals to them as well, and that will be 5 days a week. So those are a couple new programs coming. So, you know, we continue with the accessible clinical services. We look at things with the lens of health, or the health determinants. We use all the teams, building on the